I have my mammograms every year, just like I was told to do. June of 2019, I was told I had breast cancer. I just couldn't believe it because I thought I had done everything. I have a strong belief in God, but when they told me, it dropped me to my knees. Not to pray, but to scream. There's been so many people that have reached their hand out to me when I first found out I had breast cancer. But when I went to have my first chemo, even though I'm in the medical field, I thought I would go in for an hour and I would be done. So when they told me 8 hours, I was like, what? But during that first 8 hours time, Connie came to visit me. That was the first of many visits. Every time I had chemo, she would come and visit me. The thing that really strikes out to me was she asked me, she said, Rhonda, what do you need? And so I told her, what I need is help with the medical bills, the chemo, the different office visits that I had.
When I meet with a patient, frequently they would just ask for financial help, or just by talking to them, you'd eventually find out that that was really the need that they had. And a bigger worry sometimes than the cancer diagnosis, unfortunately, more focused on that than their treatment. It's hard to keep up with those unexpected bills. And then when your pay is cut, it's difficult. So many of them really worry that they're not paying their doctor. More so, I think, with paying the doctors than even the rent and the utilities sometimes, because they know that they're helping them so much. We just go ahead and I'd write up a paragraph, a story about their story, about why they needed it, and submit it to the foundation, and then they go on and pay the bill.
She said that she would look into it and see if they would be able to help me with my bills. That was a big rock off my shoulders, because even though I was working, I still was concerned about that, because I didn't know if I would be off work, if I would be able to continue to work, because I really didn't know. They just gave me that support. They made me laugh. They held my hand. And I always had 2 family members with me all the time, which I was blessed to get finished chemo before the COVID virus came, because they were there for me.
I am a mother of 2. I have a son. He's 2 years old, and I'm a new mom to a baby girl, Charlie. She is 3 months. I was going through, I guess, what every first-time mom goes through. What is this type of change, that my body is going through? Am I going to be able to carry a full-term pregnancy? What happens, if I get sick and I'm by myself? It was all of those questions that you didn't know. That process of figuring out, your body and how your body is changing and the unknown was really scary. He was born premature. He was born 34 weeks. So now it's like the difference between him and her. Okay, am I gonna make it, full term, or am I gonna have the same experience? But coming across those questions, it was nice to have my community, of the other patients and the midwives to come back to and say, hey, I've made it to my 36 weeks. Okay, what's gonna happen now? Or what can I expect?
It's providing the moms, first-time moms or recurring moms, with information, knowledge, a lot of support, and like I said, a lot of resources and referrals as far as even if they need a car seat, a crib for the baby, strollers, clothes, Pampers, just whatever they need. It's their doctor's appointment, and most people I know think it's just an ordinary doctor's appointment, but it's a lot more than that. They don't understand all the extra things that go on. The understanding that they get of what's going to go on with their bodies while they're pregnant and after, how to take care of the baby.
Being pregnant and going through the pandemic, it was extremely stressful. Are you gonna survive it? You know, if you don't survive, is your baby gonna survive? You know, you think about all of those things.
Mothers Empowered stepped up. They even provided cell phones for the moms because they had to stay in touch with the midwives. Something going on that they wasn't sure about, then they needed to make that phone call. The impact that COVID had, it's good that the moms had Mothers Empowered there. And so I can give back. I can help them with some things that they don't know. I can help them with.
I can only go back as far as '07 when I came to Dayton to do ministry, and I like to deal with the elderly. Like I go cook right now. If a friend of mine, elderly friend of mine, calls me, I go cook breakfast for them. If I gotta go to the store, I go to the store for them. I go to the nursing homes around the town before the virus, and just sit with folks, because an hour that I spend with a friend of mine who's in a nursing home and can't get out, that hour to him or her is worth more than whatever money they had in their pocket or whatever money, because they don't get the attention. When I got introduced to this place, I was taking care of a gentleman. The nurse that came to take care of him took my pressure, and my blood pressure was so high that she wanted me to go to the hospital then, you know, but I couldn't. So she referred me to the homeless clinic. I didn't have a Social Security number for about 35 years. And I've been trying myself to get one. I met Mycene Hill, and she helped me get a Social Security number. She helped me get SSI, stuff that I couldn't get.
Our paths first crossed way back in 2014. He came to the clinic for services, and he told me he was having a problem with his Social Security number. He said, "They tell me it's not my number." I had no clue what to do, so I referred him to a couple of local agencies, and apparently neither did they, because he wasn't helped. I met him again in 2019, late last year, and he had the same problem. And I was angry. Here was a U.S. citizen who couldn't get access to the benefits to which he was entitled. As a homeless patient, he had access to all our services even before I became involved. We have dental services, we have mental health counseling, we have psychiatric care, we have primary medical care, and help people access Social Security disability. We're familiar with this population, okay, and we know what the barriers are, we know what their needs are, and I think we can work very effectively with them to keep them healthy, mentally and physically.
If I need a doctor, all I gotta do is call down here. And they'll send somebody to pick me up, bring me down, take care of me. They gave me medicine. I didn't have to pay for it or anything like that. They constantly monitor my health. I walk in there and I say my name, and everybody in there recognizes ELADIO. You know, so I thank all of them, from the receptionist to my Dr. Laura. You know, God put me here to do something, not just to look out for myself. Because if I'm helping somebody else, you know, if nobody else has, you know, I'm glad that I can be able to do it.
When you're looking in and you're not the person that is going through, how it feels to just have some hope that there's somebody there that will help you and understand that you need help. Even though I work, I still needed help. And just knowing that somebody was willing to give me that help, that was a world of a blessing to me and my family. And I want to thank them, all the people that give. I want you to know you are a blessing from God.
I wish that all the people who give money to help the patients, and as a result help the families, could see the faces and the appreciation that they have when they receive this. I just encourage people to continue to do that so we can help more people, more patients and more families get through all of this.
Everything that Mothers Empowered does or is able to accomplish for the moms or the clients, the families, it could not be done without the support that they get in the community.
Keep this program open and available for as long as you can. It's necessary to give women the comfort that is needed while going through the different stages of pregnancy.
I asked the Lord for the blessings on his praise, and if he ever gave me any kind of large money, my thing, my personal, I would take a lot of that money and just donate it to keep this place going. The people who's got the money that don't have to worry about doctors, they have to stop and think of the homeless guy that's walking by that doesn't have a home, you know, or the elderly that comes here, you know. We all need some help.